Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Doug Iliff of Topeka about whooping cough. Thanks for being here today, Dr. Iliff. Now, what can you tell us about the epidemic of whooping cough?
Well, as you probably know, we're having an epidemic of pertussis, or whooping cough, in Kansas right now. Some people think that the whooping cough is eliminated completely, like polio, but it has not been. In adults, it causes a severe, prolonged cough, may last for weeks or months, even after antibiotic treatment has successfully eliminated the bacteria. And so it's a real problem there. For children, before the whooping cough vaccine came along, we used to have 9,000 children die a year in this country. Now it's down to 10 or 20. Unfortunately, many years ago, when I was working in the Stormont emergency room, I saw one of these children die, and it was really a terrifying experience. It was because the parents didn't believe in immunizations.
So is the immunization effective then?
Well, the immunization is quite effective. Children get 5 immunizations against whooping cough. It's the DPT, or diphtheria, pertussis, tetanus vaccine. They get it at 2, 4, 6, 15 months, and then at 5 years. Now, it's very effective at protecting against whooping cough. 7 out of 10 kids 5 years later will still be completely protected, and the other 3 out of 10 have partial protection. They might get the disease, but they won't die.
Why do you think we're hearing more about it right now?
Well, partly it's because of the epidemic, but it's also because of a couple of problems. Prior to 2005, approximately, we did not have the pertussis vaccination in adult diphtheria and tetanus. And that's probably why we're seeing more problems with adults right now. Children have a little different problem. Up till the 1990s, the vaccine was more effective than it is now. After that point, they started using an acellular vaccine, which wasn't quite as effective. It did produce less side effects when children got the shots, but the protection was not as good as the previous vaccine. So you put those two things together, and now we've got a bit of a problem.
Okay, so who needs the new vaccine?
Well, probably everyone that's an adult, because most people have not had it. It's important that adults find out if they have had the Tdap vaccine, the new one, and if they haven't, they should get it. If they don't know whether or not they've had it, they should go ahead and get it anyway. This is especially important for pregnant mothers. A baby doesn't get any protection in the first 2 months of life when they're very vulnerable. If the mother is immunized at least 2 weeks before delivery, then the baby gets passive immunity during those first 2 months until the vaccinations start. But since 80% of pertussis is passed on by family members, grandparents need to get the vaccine, dads need to get the vaccine, and we presume that other children in the family will already have had it. I guess the take-home lesson is, if you don't know whether you've had the vaccine, go ahead and get it. It doesn't hurt to get too many.
Okay, great. Good information. Thanks for being here today.
You're welcome.
Please join us next week for a new health topic discussion on House Calls.